Welcome to part two, the history of Lyft. As a reminder, I'm Samantha Harden, and I'm excited to share more about this project that started through Virginia Cooperative Extension, and Lyft stands for Lifelong Improvements Through Fitness Together. Our learning objectives are to contextualize Lyft as a product of strong women, strong bones, stay strong, stay healthy, and activity for the ages. We'll understand and identify the core elements of the Lyft program, such as the dose, behavior change strategies around it, and how to engage in exercise safety. And then we'll also talk about some of the preliminary evidence or outcomes of Lyft. There are many programs that informed the development of Lyft. These are three of the main programs where different components of them were adapted and tested to see what Virginia Cooperative Extension needed in terms of promoting physical activity and fruit and vegetable consumption for aging adults in the community. The first one I'll point out is Strong Women, Strong Bones. This program was two-stage 12-week program for midlife and older women focused on exercise and nutrition. The primary outcome was really about bone strength to reduce osteoporosis and osteoporosis symptoms and outcomes. Another program is an adaptation of Strong Women, Strong Bones. Stay Strong, Stay Healthy out of the University of Missouri, specifically by Dr. Steve Ball in Extension, was then adapted to be a 10-week program to enhance health and well-being of middle-aged and older adults and to include male and female participants. Another program was Activity for the Ages, which was a 12-session program developed to promote physical activity for older adults and didn't necessarily have a strict exercise routine, but was really about the group or community component to help people adhere to physical activity. These three programs have similar core elements, but are slightly different from each other and from Lyft. But we were able to use the strong evidence base and the success of each of these programs to develop and test our adapted version of these programs. So what adaptations were made? We have an article about that you can review as well. And we used an integrated research practice partnership to inform these adaptations. That means we had community extension agents work with researchers to say what was working or wasn't working about the different programs that were already available in the community. So first, the Virginia Cooperative Extension agents suggested that we needed some basic nutrition information around fruit and vegetable consumption. As Cooperative Extension is tied to the U.S. Department of Agriculture, we really wanted to still stick with our roots around fruits and vegetables and the nutrition education side of things. The second big adaptation was that we really wanted social support to reduce a perception of social isolation that is often experienced by older adults. Some people are widows or widowers or living in rural areas or only seeing folks about once a week, whereas with this program, they're able to build community within their class or just have that social support re-engaged that helps them dive deeper into relationship with other people in their communities. And then the third main adaptation from Strong Women, Strong Bones to Lyft is that we really wanted to focus on not just the strength training and the bone strength and osteoporosis prevention, but we also wanted to start building towards that 150 minutes of moderate intensity aerobic activity. So the results of our study back in 2015 was that we were able to really have a holistic program that had fruit and vegetable consumption, a group-based component, and both sets of the physical activity guidelines for Americans from the muscle strengthening and the aerobic activity component. And now I'd like to share a bit more about the Lyft core elements. Core elements are really this way of saying what works, what were the mechanisms of why the program works, and what are some of the things we want to make sure we do all the time across all states that are engaging in the program so that we can ensure that the benefits will be had by our participants and safety will be maintained. But also we start with have fun. So really, we know that particularly for adults and older adults, exercise or exercise routines or weight loss or weight management and all these things often have a negative connotation. And so if we start with the fact that this is your ability to have fun, get out, move in the vessel that is your body, keep up with your grandkids and things like that, then we're able to start from a place of this is about living your best life, not just another chore on the to-do list. The second core element is to stay within your range of motion. The parsilab.org/lift website has lots of resources on how to cue if we have upper or lower body mobility limitations and alternatives to the moves to ensure safety. But if we continue to prompt or cue when we deliver lift for people to stay within their own range of motion, that'll eventually create a repetition so that folks really know to stay within their range of motion, not what they see someone else in the room or on the Zoom doing. We also really want to encourage not using momentum to get into the exercise. So one of the things we see as people might be learning how to use dumbbells or to do muscle strengthening activities for the first time is that they might swing. So getting out of range of motion, it might be really fun, but we might be using momentum to lift up instead of the muscular engagement. One of the best cues or opportunities here for you as the lift instructor is to say, let's try doing this without any added weight or dumbbells and just really getting into our range of motion and the moves without using momentum, but rather using strength and intentional movements. We do actually invite you to do the very first class with no weights so that everyone can learn the moves in sequence so we start to build confidence. The fourth core element is that the class is offered 2 times per week for 8 weeks. So it's a total of 16 sessions. We often get questions about this one. Is it okay to only offer it once a week? What are our opportunities here? We know from the evidence that muscle strengthening activities conducted twice a week are the best for the matching with the physical activity guidelines for Americans. And this does make it a bit of an intensive program, but that's an opportunity for education, social connection, finding experiential learning, and really mastering the exercises that are available. We also encourage tracking aerobic activity outside of class. So the class does include a warm-up, the core movements, and then a cool down with balance and flexibility, but we also want to encourage getting up to the 150 minutes outside of class so that we're meeting the full physical activity guidelines for Americans. As you may recall from part 1, slow incremental increases really help. So you'll see that this says track aerobic activity. It doesn't necessarily say get 150 minutes. We don't want to discourage, we want to have fun. So maybe if your participant is only getting 10 to 20 minutes of moderate intensity aerobic activity at baseline, they might want to maintain that and then slowly improve over time. So it's really the practice of tracking, becoming aware, making those changes, getting feedback from you during their lift classes, and then starting to get their way towards the 150 minutes of moderate intensity aerobic activity. The next core element is to build relationships with peers. One of the unique components about Lift is that it is based on principles of a group dynamics approach. I don't know about you all, but sometimes I can go to a fitness class and not talk to a single person around me. Sometimes if that means I'm using it as an opportunity to disconnect or have some self-care, that might be great. But really what's happening is that I'm an introvert and I don't have any way to reach out or talk to someone unless I'm invited to. And as a person, as the Lift instructor, we can give people permission to build relationships with their peers. Every single week includes a prompt to really get to know each other. This is based on the psychological principle of deep and surface level similarities. So we might come in and see, oh, most of us look like we might be aging adults, but that's just a surface level similarity. What we might learn is that we both like to crochet, or we both like to garden, or many people in our group shop at the same grocery store. Just little things to get to know routine and things that you value, and it can start surface level and start to get a little bit deeper. What are your main values? What are things that you've overcome in your life? How do you use your body to keep up with your grandkids or function in your daily life? What are your concerns? What are some of the barriers or embarrassments about building up towards meeting these physical activity guidelines for Americans? Our bodies are changing and shifting, and you may feel like this is a real challenge because it's acknowledging that I might not be as strong as I used to be, but using Lyft to meet ourselves where we are. But that shared social support of we've all been there really helps get the program to be beyond just the physical, but it also becomes the emotional and social. The seventh core element is to learn about resources in the community. As extension professionals, one of the analogies I hear the most is that we are bridges. We are able to bridge knowledge, we are able to bridge people, we are able to bridge resources. So as the Lyft instructor, it's really great to have a document or some sort of resource or build community partnerships where you say, what are some of the opportunities for physical activity or using different spaces or mall walks, and what's Parks and Rec up to? Like, how can we refer some of our Lyft participants to ongoing community resources that exist so that people are able to maintain their new behavior when the program ends? And then the eighth and final element is to measure progress. We'll talk about some objective and subjective ways to capture the impacts that Lyft is having on an individual and the community. But without measuring our progress, we're not able to engage in feedback. So we lose a little bit of that behavior change strategy of goal setting, self-monitoring, and getting feedback. So these 8 core elements are what make Lyft work and make them fun to deliver, make the sessions fun to deliver, as well as impactful in terms of physical activity, fruit and vegetable consumption, and a reduction of social isolation. So for all of you who are super interested in the last core element, which is measuring progress, this is just a quick snapshot. I'll try to move my body out of the way here. A quick snapshot of how Lyft worked when we originally tested it. This is called the Rickley and Jones Functional Fitness Assessment. On the left side of the screen, you can see some of the ways that we assess upper and lower body strength, flexibility, and agility through an 8-minute or an 8-foot up and go. So seated from a chair, getting up, moving around a cone, and sitting back down, as well as a composite balance score. So there's a balance challenge that starts in a mountain pose or both feet on the ground, palms forward, gazing forward and eyes open. And then it progresses to see how many of the different stages you can safely move through for the duration. And also pictured here on this slide is our baseline and our post-program improvements. And the asterisks or the stars are what indicate that all of the movements had statistically significant improvements from baseline to post-program. So increasing our flexibility, increasing the balance, and increasing strength. So with these data, we felt confident in moving forward in order to bring a holistic physical activity and fruit and vegetable consumption program across the state of Virginia and then spread out throughout the rest of the nation as well. A couple of things going forward. One of the reasons I'm coming to you today in this virtual space using technology is because this program is alive and well and very adaptable. What we know from dissemination and implementation science is that once something's tested in a controlled setting, certain ongoing adaptations may be necessary to make the program fit within your community. Maybe you're doing something where We've tested this program with people who are 65 years of age and older and mostly living in rural areas, but maybe you have a different audience that you're targeting, but they could really benefit from these basic physical activity and fruit and vegetable education, experiential learning, and the social support. So we really wanted to remove our academic control by making this program open access to you. We still want to have a focus on safety, hence your roadmap to becoming an instructor includes all of this background knowledge and education, as well as your demonstration and you're getting feedback, and then you'll get your certificate. So we really wanted to say, we know that the people who are delivering lift in the community are those who are going to have their pulse on what the community needs and adaptations that are needed. So if you'd like to learn a little bit more about this, you can also head to this paper in Preventing Chronic Disease. But as you can see from the abstract snapshot, we have the program in over 4 states with over 275 instructors. The number's closer to 350 at this point, and perhaps you are our newest instructor, or you might be engaging in a train-the-trainer model so that you can help increase the number of people who feel confident and competent in leading LIFT in their communities. In summary, LIFT is an 8-week strength training program that can significantly improve strength, flexibility, agility, dynamic balance, and aerobic endurance. It's been delivered to over 4,000 participants since 2015, and we are incredibly proud of all of the instructors and the participants who have made this work so successful within the state of Virginia and beyond.